October, of course, is Breast Cancer Awareness Month, and we are so pleased to have with us Dr. Grace Makari-Judson, chair of the Baystate Health Breast Network, an oncologist. She's co-author of Coping with Chemotherapy and Radiation and an expert in every sense of the word on breast cancer. It's so good to have you here, doctor. Thank you for making time.
It's a pleasure to be here, Jim.
A lot of attention these days focusing on the genetic factors associated with breast cancer, specifically research around the BRCA genes, mutations that occur there. What does it all mean? And I realize we could talk for hours about that. What may it tell us about breast cancer and treating breast cancer?
Well, only 5 to 10 out of 100 women with breast cancer got breast cancer because they inherited one of these susceptibility genes. But it is helpful to identify individuals that have these genes, not so much because today it affects treatment, but because if we identify people before a diagnosis, there's the hope of preventing breast cancer. And so that's important. And a woman that already has a diagnosis of breast cancer, it may help her to make decisions to reduce risks of other cancers, such as ovarian cancer. But in her relatives, if they are found to have a mutation, it may help them to hopefully prevent a diagnosis of breast cancer altogether.
Who should be tested for the BRCA genes? Are there markers? Are there predictors? Because I'm sure for a lot of reasons, you can't test everybody, and it wouldn't be wise to do so. Who should be?
Right. Well, there are very specific criteria that are set out, and there are different criteria for individuals that have a cancer diagnosis and different criteria for individuals in a family. So in women that have a diagnosis of breast cancer, if they were diagnosed at a very young age, if they had breast cancer and ovarian cancer, if they had certain types of breast cancer, if they're from certain ethnic backgrounds, for example, if they're of Ashkenazi Jewish descent. So those are all factors that we'll take into consideration to see if an individual woman with breast cancer is someone that meets criteria for testing. In terms of family members, if someone has a family history, but there's no one in the family with cancer that's available for testing, in those people we usually look at the number of relatives, the age of diagnosis, the types of cancers. So it's actually very complex process to try to determine if someone meets the criteria for testing. In addition, Jim, the whole situation has changed a lot in the last few years. A few years ago, we had one test and one laboratory that performed the testing. Now we have a panel of genes that we can test for, and we have a number of different laboratories that do the testing. So what's happened is that certain insurance companies are saying, well, we'll only cover this test done by this laboratory. So we have to go through a third level of evaluation to see which insurance company is approving which test. We have a program at Baystate, the Family Cancer Risk Program, that really has been developed to help people through this very complicated process. And so what we try to do is get all the information about the family history up front, so an individual is prepared for the visit. If they meet the criteria for testing, we've already determined that up front. And if we need to use certain laboratories because of insurance issues, again, we've determined that. So the goal of our program is to try to test the right person from the family at the right time with the right test.
As you pointed out, it's a pretty small percentage of all breast cancer cases that are associated with the BRCA genes. What do we know? What do scientists, what do researchers, what do people like you know about the majority of breast cancer cases? Is there thought on what may cause? We know cancer comes in any form for all kinds of different reasons.
Right.
Are there preventive or protective things we can do?
Yeah. So breast cancer, like all cancers, is a diagnosis of aging. So as one gets older, they are at higher risk for breast cancer. There are other factors, hormonal factors, other factors that may have to do with benign breast disease. And so we try to identify those factors. Sometimes an individual may have had a breast biopsy that shows certain precursor lesions that we associate with a higher lifetime risk of breast cancer. We like to identify those individuals so that we can consider them for preventative strategies. There are medications, at least 3 of them, that have been shown to reduce the risk of developing breast cancer by at least 50%. However, these preventative medications have not been well received in the general community primary care physicians are not comfortable talking about it. A lot of women are not necessarily comfortable taking a medicine for prevention. So we need to do more to try to find medications that are acceptable and strategies that are acceptable to women to be able to do a better job at preventing breast cancer.
We talk a lot about lifestyle and behavioral factors, fatty diet in many types of cancer, smoking, alcohol use or overuse. Do we have any indications at all if breast cancer is involved there?
Well, first of all, there is no breast cancer prevention diet. I wish there was. I wish I could write a book on that. There certainly is information. Smoking, we know, is associated with a lot of cancers. Breast cancer is no different. There's a very slight but not major effect in terms of increasing breast cancer risk. Alcohol, women that don't drink at all have a lower breast cancer risk than women that drink, for example, in moderation. In terms of exercise, the good news is that women that exercise regularly can reduce their risk of developing breast cancer. And they don't necessarily have to be women that have exercised all their lives. They could be women that started exercising, for example, later in life. 2 to 3 hours of exercise a week is, certainly something that's ideal, but even lesser amounts may help to contribute to reducing risk.
A few years back, we were all talking about the Katie Couric effect as far as colon and rectal cancer was concerned. Her husband died very young of that. She had a colonoscopy live on TV, urged others to do so. A lot of people went in, and probably a lot of disease was caught early. We saw actress Angelina Jolie a year or so ago say she had her breasts prophylactically removed because there was strong history, and I think it was BRCA related in her family. Her mom's death rather young. Have you seen an impact on people, women coming in, getting tests because of the attention? Is there an Angelina Jolie effect?
There is, and in fact, people refer it to that. We probably had at Baystate double the amount of women that are interested in genetic testing based on this. A couple of things happened at the same time. That the price of the test may have come down a little bit more. Insurance companies are covering it. There was also the Genetic Information Non-Discrimination Act that helped put people at ease a little bit about concerns about discrimination with health insurance based on genetic test results. So absolutely, we are seeing more women interested in testing, and when women test positive, there are other options other than bilateral mastectomy with immediate reconstruction, but many women are more comfortable with having the surgery so that they don't have to go through mammograms, they don't have to go through the intensive surveillance.
You've studied breast cancer for years. You live day and night with this topic and care, I know, so much for your patients. Is there anything out there, and there's a lot of research going on, is there anything out there in research that you're hearing about that just piques your interest and you say, I think that's really onto something. Maybe is there anything particular you're excited about?
Well, I'm very excited about some of the work that we're doing in breast cancer prevention. The Rays of Hope Center for Breast Cancer Research, one of the areas that we're very focused on are trying to look at those strategies to reduce breast cancer risk and trying to, again, from a molecular level, determine how we can best predict who are the people that might be at higher risk that may need more attention. I think the other area that I'm very excited about is in the last decade, we've been doing more and more with targeted treatments. And every year there are new treatments, new drugs that are not for all patients with breast cancer, but for very small subsets that may have a certain type of abnormality in their breast cancer. Jim, what we're learning is breast cancer is really many different diseases. It's not one disease. So there's not a one-size-fits-all treatment. We're really individualizing treatment based on factors we see under the microscope in the tumor.
Well, Dr. Grace Makari-Judson, Baystate Health Breast Network Chair, thank you for all you're doing. Thanks for your time with us today.
My pleasure.